Instead of asking, "How are you?" most nurses usually ask, "How are you feeling today?" Let's practice some natural bedside small talk in English. Repeat after me. How are you feeling today? Did you sleep well last night? How is your pain today? Have you been able to eat this morning? Are you drinking enough water? Any bowel movement today? Are you passing gas? Any nausea or dizziness? How's your appetite been? Are you feeling strong enough to walk a little? Do you want to rest a little before we continue? Did your family visit today? Is there anything you're worried about? Hey, great job so far. If you want more practice, check out my free guide, 10 Steps to Confidence in Medical English. Now, let's try a quick role play. I will be the patient and you will be the nurse. Ready? A little tired, but okay. Not really. I woke up quite a few times. About a 4 out of 10. Not yet. Yes, a little. Not so good. I didn't really feel like eating breakfast. Thank you. That makes me feel a little better. In English, "you're in good hands" means you don't need to worry. The person taking care of you is skilled and caring. Hey, great work today. These are phrases nurses actually use at the bedside. Thank you for watching. See you next time. Don't forget to subscribe to Fluent Nurse.